Hey, NCLEX aspirants! Welcome back to another power-packed NCLEX prep session. Every single day in this series, we're covering 2 to 3 high-yield topics, along with practice MCQs that sharpen both your knowledge and exam strategy. If you stay with us daily for the next 30 days, you'll be ready to pass the NCLEX on your very first attempt. Step by step, concept by concept, we'll make your foundation stronger and exam confidence unshakable. But before we dive into today's lesson, let me share something big. We've launched our complete NCLEX review crash course, already trusted by over 10,000 students who cleared NCLEX on their first try. Here's what you get when you enroll. Live daily classes with expert guidance, 500+ hours of recorded lectures for anytime revision, 100+ hours of animated crash lessons to simplify tough concepts, 5,000 NCLEX style and previously asked questions, 15 CAT mock tests in real NCLEX format, Next-Gen NCLEX question practice pack, detailed lectures plus PDF notes plus NCLEX ebook, and so much more, all in one place. Right now, you can grab this entire package at a massive 70% discount, but only for a very short time. Click the WhatsApp link in the description to claim your free 5-day trial and start your NCLEX journey today. And don't forget, you can also join our Telegram channel for extra free practice questions. Link is in the description too. Today, we are going to dive deep into perioperative nursing, a very high-yield area for your NCLEX preparation. Remember, perioperative nursing covers everything from the time a patient learns that surgery is needed, through the operation itself, and into the recovery period. Our role as nurses is to prepare, protect, and prevent complications. Think of it as 3 phases: preoperative, intraoperative, and postoperative. Let's explore each step carefully, and along the way, I will highlight NCLEX pearls that you cannot afford to miss. Let us begin with the first stage, the preoperative phase, which starts as soon as the surgery is scheduled and ends when the patient is taken to the operating room. This phase is all about preparation. The nurse begins with a thorough assessment, checking baseline vital signs, allergy history, and reviewing all medications. Pay close attention to high-risk drugs such as anticoagulants like warfarin, heparin, and aspirin, antihypertensives, insulin, and even herbal supplements like ginkgo or garlic, since these can increase bleeding. It is also important to ask about any past surgical or anesthesia experiences and to assess the patient's psychological status, because anxiety and fear are very common before surgery. Next comes informed consent. The surgeon is responsible for explaining the procedure, risks, and benefits, but the nurse plays a key role in witnessing the signature and ensuring the patient understands. If a patient has further questions, the nurse does not explain beyond scope. Instead, the provider must be called back in. The nurse then provides preoperative teaching, which is vital for patient safety and recovery. Patients should learn about deep breathing, coughing, incentive spirometry, splinting incisions with a pillow, and the importance of early ambulation. They should also be prepared for what to expect, such as the presence of an IV line, urinary catheter, or drains, so nothing comes as a surprise. Finally, safety preparation must be completed. This includes ensuring the patient is NPO for 6 to 8 hours, administering prescribed pre-op medications like sedatives or prophylactic antibiotics, verifying identification, confirming surgical site marking, and completing the surgical checklist. Remove dentures, jewelry, nail polish, and prosthetics to reduce risks. NCLEX Pearl. If consent has not been signed and you are about to give pre-op sedatives, stop immediately and get the consent first. Once sedated, a patient cannot legally consent. Now, let us move into the intraoperative phase, which begins once the patient enters the operating room and ends when they are transferred to the post-anesthesia care unit, or PACU. This phase is about protecting the patient while they cannot protect themselves. The circulating nurse plays a non-sterile role, managing the environment, ensuring patient safety, documenting all care, and advocating for the patient. This nurse checks equipment, monitors the septic technique, and verifies surgical counts of sponges and instruments. The scrub nurse or scrub technician maintains the sterile field, prepares instruments, and assists the surgeon directly. In terms of patient safety, positioning is critical to avoid nerve damage and pressure injuries. Elbows and heels must be padded, and grounding pads must be used correctly to prevent burns from cautery machines. Nurses also need to monitor for hypothermia in long surgeries. The nurse also collaborates closely with anesthesia providers to ensure continuous monitoring of airway, oxygenation, cardiac rhythm, and level of consciousness. A key emergency to watch for is malignant hyperthermia, a life-threatening reaction marked by muscle rigidity, high fever, and tachycardia. The immediate treatment is stopping anesthesia, giving dantrolene, and initiating cooling measures. NCLEX. Pearl. If sterility is ever broken, the nurse must call it out immediately, even if it delays surgery. Patient safety always comes first. After the surgery is complete, we enter the post-operative phase, which begins in the PACU and continues until the patient fully recovers or is discharged. This phase is about preventing complications. The nurse's first responsibility is the ABCS: airway, breathing, and circulation. Always check the airway first, looking for obstruction, stridor, or decreased oxygen saturation. If the patient is unconscious, position them on their side to prevent aspiration. Monitor blood pressure, heart rate, urine output, and skin color to ensure circulation is stable. Next, watch closely for complications. Hypovolemic shock presents as low blood pressure, rapid thready pulse, clammy skin, and decreased urine output. Hemorrhage may show up as excessive bleeding, swelling, or abdominal distension. Thromboembolism or DVT causes calf pain, swelling, and redness. Respiratory issues like atelectasis or pneumonia are also common from shallow breathing or immobility. Pain management is essential and should include both pharmacological interventions, like opioids or NSAIDs, and non-pharmacological strategies, such as positioning, splinting, or relaxation techniques. Pain should be assessed frequently with standardized scales. Finally, effective patient teaching prepares the patient for discharge. They should be instructed on wound care, diet progression, activity restrictions, and when to call the provider. For example, if they develop fever, chills, purulent drainage, difficulty breathing, or calf pain. Emphasize the importance of ambulation to prevent ileus and blood clots. NCLEX Pearl. If oxygen saturation drops in the PACU, your very first action is to reposition the airway and head. Do not jump straight to oxygen or provider calls until the airway is secured. 4. Common NCLEX focus areas. To quickly review, the most commonly tested areas on NCLEX include pre-op NPO rules, informed consent responsibilities, and teaching. Intra-op roles of the circulating and scrub nurse, plus malignant hyperthermia. And post-op ABCS, shock recognition, early ambulation, and wound care. 5. High-yield memory tricks. And finally, let me give you some easy memory tricks to tie it all together. Think of the 3 P's of perioperative nursing. Pre-op is preparation, intra-op is protection, and post-op is prevention. Always remember airway first in PACU situations. And never forget the consent rule. No consent means no pre-op medications. So, to wrap up, perioperative nursing is a cycle of preparation, protection, and prevention. If you keep the 3 P's in mind and prioritize patient safety at every stage, you will not only master this topic for NCLEX, but also become a reliable advocate for your patients undergoing surgery. Dear aspirants, before starting question session, I want to share this with you all. We've launched our complete NCLEX review crash course, already trusted by over 10,000 students who cleared NCLEX on their first try. Here's what you get when you enroll. Live daily classes with expert guidance. 500+ hours of recorded lectures for anytime revision. 100+ hours of animated crash lessons to simplify tough concepts. 5,000 NCLEX style and previously asked questions. 15 CAT mock tests in real NCLEX format. Next-Gen NCLEX question practice pack. Detailed lectures plus PDF notes plus NCLEX ebook. And so much more, all in one place. Right now, you can grab this entire package at a massive 70% discount, but only for a very short time. Click the WhatsApp link in the description to claim your free 5-day trial and start your NCLEX journey today. And don't forget, you can also join our Telegram channel for extra free practice questions. Link is in the description too. Transition into Question 1. Let us begin with the foundation of preoperative safety, because before a patient goes to the operating room, certain steps must always be completed. Question 1. A nurse is preparing a patient for surgery. Which action should be performed before administering preoperative sedatives? Here are options. A. Check the patient's vital signs. B. Ensure informed consent is signed. C. Ask the patient about pain level. D. Verify the surgical site marking. The correct answer is option B. Ensure informed consent is signed. Rationale. Consent must be signed before sedatives are given, otherwise the patient cannot legally consent once sedated. Checking vitals, pain level, or surgical site marking are important, but none take priority over informed consent. Transition into question 2. Now that we know consent is critical, let us focus on the emotional side. Patients often feel fear or anxiety before surgery. How should the nurse respond? Question 2. A patient scheduled for abdominal surgery expresses anxiety. Which nursing response is most therapeutic? Options: A. Do not worry, everything will be fine. B. Can you tell me more about what is making you anxious? C. Your doctor is very experienced, so there is no need to be afraid. D. You should try to stay positive. The correct answer is option B. Can you tell me more about what is making you anxious? Rationale. Open-ended exploration allows the patient to share fears, showing empathy and support. The other responses either give false reassurance, dismiss emotions, or tell the patient how to feel, which are non-therapeutic. Transition into question 3. Once the patient enters the operating room, the nurse's role shifts. Let us test your knowledge of intraoperative responsibilities. Question 3. Which role is the circulating nurse responsible for during surgery? Options: A. Handing instruments to the surgeon. B. Maintaining sterility at the surgical field. C. Documenting care and ensuring safety. D. Closing the surgical incision. The correct answer is option C. Documenting care and ensuring safety. Rationale. The circulating nurse handles non-sterile duties, patient advocacy, and safety documentation. The scrub nurse manages instruments and sterility, while the surgeon closes incisions. Transition into question 4. During surgery, emergencies can arise. One of the most dangerous is malignant hyperthermia. Let us see how you would respond. Question 4. During surgery, the patient develops muscle rigidity, tachycardia, and a rapid rise in temperature. What is the nurse's first action? Options: A. Administer dantrolene sodium. B. Apply a cooling blanket. C. Stop anesthesia immediately. D. Increase IV fluids. The correct answer is option C. Stop anesthesia immediately. Rationale. The very first action is to discontinue the anesthetic agent that triggered malignant hyperthermia. Only then should dantrolene, cooling, and fluids follow. Transition into question 5. After surgery, the focus shifts to recovery in the PACU, where airway problems are common. Here is a classic NCLEX scenario. Question 5. In PACU, a patient's oxygen saturation drops to 85%. What should the nurse do first? Options: A. Call the surgeon immediately. B. Apply supplemental oxygen. C. Reposition the airway and head. D. Increase the IV fluid rate. The correct answer is option C. Reposition the airway and head. Rationale. Airway obstruction is the most likely cause immediately after anesthesia. Repositioning should be done before oxygen or physician notification. Transition into question 6. Next, let us identify which post-operative findings are urgent and require immediate action. Question 6. Which post-operative finding requires immediate intervention? Options: A. Small amount of serosanguinous drainage on dressing. B. Patient complaining of incisional pain rated 6 out of 10. C. Blood pressure 78/40 with rapid, thready pulse. D. Mild nausea after anesthesia. The correct answer is option C. Blood pressure 78/40 with rapid, thready pulse. Rationale. These are signs of hypovolemic shock or hemorrhage, which are life-threatening. The other options are expected or mild complications. Transition into question 7. Now let us shift to prevention, specifically respiratory complications, which are among the most common after surgery. Question 7. The nurse is caring for a patient who had abdominal surgery. Which intervention best prevents respiratory complications? Options: A. Encourage splinting with a pillow during coughing. B. Keep the patient on strict bed rest for 24 hours. C. Administer opioid analgesics every 2 hours. D. Offer small sips of water frequently. The correct answer is option A. Encourage splinting with a pillow during coughing. Rationale. Splinting reduces pain and supports effective coughing, which prevents atelectasis and pneumonia. Bed rest increases risk. Opioids help pain, but not lung expansion. And fluids do not directly prevent pulmonary complications. Transition into question 8. Education is just as important. Let us test how well patients understand their discharge instructions. Question 8. Which statement made by a patient indicates understanding of postoperative teaching? Options. A. I will remain in bed for 2 weeks to avoid pain. B. I should report any fever or drainage at the incision site. C. I will avoid coughing because it may open my stitches. D. I should double my pain medication if the pain is severe. The correct answer is option B. I should report any fever or drainage at the incision site. Rationale. Fever and drainage indicate infection and must be reported. The other responses show misconceptions that increase risk. Transition into question 9. Let us now look at medication safety. Many patients arrive for surgery taking anticoagulants. How should this be managed? Question 9. A patient taking warfarin is scheduled for elective surgery. What is the priority preoperative action? Options. A. Stop warfarin several days before surgery as prescribed. B. Encourage extra fluids to flush the drug. C. Administer warfarin the night before surgery. D. Increase intake of vitamin K-rich foods. The correct answer is option A. Stop warfarin several days before surgery as prescribed. Rationale. Anticoagulants are usually stopped 5 to 7 days before surgery to reduce bleeding risk. The other actions are ineffective or dangerous. Transition into question 10. And finally, let us return to the surgical checklist, because missing one crucial item can stop surgery from starting. Question 10. The nurse is reviewing the surgical checklist. Which item, if not completed, would delay surgery? See the options. A. Patient has dentures removed. B. NPO status maintained for 8 hours. C. Signed consent missing from the chart. D. IV access not yet started. The correct answer is option C. Signed consent missing from the chart. Rationale. Surgery cannot proceed without legal consent except in emergencies. Dentures, IV access, or NPO status can be addressed, but missing consent is an absolute barrier.